My name is David DiMuzio, and I'm a professional singer-performer. I've performed in over 90 countries around the world, and I had a record deal in the Philippines. My career was really taking off there, and that was when I was starting to go the most bald. And I could feel it as I was performing, watching my career take off, that my hair was holding me back. When I thought about all of the entertainers that I love and the biggest stars in the world, the lead singers, all of them have great hair. And I started wearing a baseball cap in all my videos because I could just feel that people thought of me differently because of my lack of hair. And that was really frustrating. So I decided to get a hair transplant. I searched on the Yellow Pages, I think at that time, was how I first started looking up into hair transplant doctors. And there was actually one I found out who lived, or who had a practice about 2 blocks away from where I lived. So I thought, wow, that's great. So I went down there and I looked at the before and after pictures from this guy, and they were absolutely horrific. I couldn't believe how awful they were. I couldn't believe that this surgeon was impressed enough with these before and afters to even show them to someone. And it scared me off of hair transplants, actually. At that point, I saw that and I thought, that's all there is. I guess this is a hair transplant, is this awful looking pluggy thing. Because this is what a surgeon is proud to show. And so I went back and I decided, forget that, I'm getting off all drugs, I'm gonna be a bald guy, that's it. About, I don't know, a year later or so, I was searching on YouTube and I saw some results that actually looked really good. And I thought, wow, maybe I just saw somebody who was bad and maybe good results can be done. And so I ended up contacting that doctor and contacting some surgeons that doctor's consultant also recommended as being good surgeons. And I realized that really good work could be done. And so that's when I decided, okay, you know what? I just found the wrong guy to start with. I'm going to do more research and really go through with this. So I had my first hair transplant. I felt that it was really successful, and obviously most people who have extreme hair loss like I did need multiple procedures in order to get their hair looking good. So I had a second transplant, and that one was a little bit more iffy. I felt like there was a little bit of work in my hairline that needed to be done to soften it up, and some work in my crown as well. So that's when I found Dr. McGrath. Dr. McGrath really has a nice confidence about him, but it's not a God complex confidence like I'd come in contact with in the past. So I like that, and I got more of a doctor feeling from him. Not only was a surgeon, but that really knew about medicine and really knew what he was doing and knew how to take care of a patient. So I love that, and I saw a bunch of before and afters in his office, and he had a really professional setup, so I felt really confident going into that. The recovery process with Dr. McGrath was by far the easiest recovery process of my 3 procedures. It was incredible. Like, it's almost, if I told you, you wouldn't believe me, because, and I've told other people, they're like, no, it had to be more painful than that, it had to be more trouble than that. But I actually did not take a single piece of pain medication once I left the office. So it's been about 2 to 3 years since I had my last procedure. It's been my last hair transplant procedure, and obviously I was happy with my results. The main thing is that I've learned so much more about hair transplants since then from Dr. McGrath. I'm quite interested in hair transplants and hair loss and how that all works, and so I would highly recommend that anyone who's interested in having surgery with Dr. McGrath, they kind of jump in, you know, and watch and go see his before and afters in person, which he's happy to show you. And I think, you know, your confidence is going to be to the point that you're going to want to have surgery here.